Hello, my name is Ines Peric. I'm Education Program Officer at RCSI Institute of Global Surgery. And my talk today is about Global Surgical Training Challenge Mentorship Program and how it is supporting innovation in surgical training. Up to 17 million people, particularly in low and middle income countries, die every year from lack of access to surgical care. The Lancet Commission identified the development of a surgical workforce as a key indicator for addressing this critical need. Low and middle income countries are disproportionately affected by low surgical workforce density. It is just insufficient to meet the needs of the population of those countries. A significant barrier to scaling up surgical training in low-resource environments is, on one hand, scarcity of surgical trainers, and on the other, lack of access to simulation-based training. The Global Surgical Training Challenge is responding to these barriers by incentivizing and supporting the creation of low-cost, open-source, easily reproducible surgical simulators. An example of one you can see on the picture here. Each surgical simulation module that is developed as part of the challenge has a self-assessment framework, which allows surgical practitioners and surgical trainees to test their newly acquired skills without the presence of a trainer. The rationale is to harness the expertise of surgeons, engineers, educationalists, and other experts who are based in low and middle income countries to work collaboratively on new ideas, which are often outside of their own comfort zone. The challenge is divided in 3 stages. The first one is Discovery Awards. These were initial grants to allow teams to develop and test their prototype surgical modules. So 10 teams participated in this phase. It started in early 2021 and it ended at the end of 2021 when 4 teams were chosen to continue to the next stage of finalist awards, and they were given grants to further develop and improve their original prototypes. So the finalist award stage with 4 teams started at the beginning of 2022. And it is ending very soon, as the grand prize of $1 million will be awarded in January 2023 to the finalist team deemed to have most successfully developed their original prototype and created the most impact through further module development. So let's take a look at the 4 finalist teams and different surgical specialty areas and countries that are represented. So there is a variety of surgical specialty areas, from trauma to reconstructive surgery, tibial fracture fixation, laparoscopic surgery. The teams can have members based in high-income countries, as you can see here that, for example, United States, United Kingdom, Canada are represented, but they have to be based in low and middle-income countries. And the majority of the team members are based there. So countries include South American ones like Guatemala, Ecuador, and Chile, and Africa, Ghana, Uganda, Cameroon, Kenya, etc. So how does the mentorship program fit into this? The Royal College of Surgeons in Ireland is supporting these low and middle income country-based teams competing in the challenge by providing a tailored mentorship program for each team. So RCSI assigns a mentorship manager to build a one-to-one relationship with each team in order to understand the individual needs of the project. So we started participating in the challenge at the beginning of Discovery Award phase. So there were 10 teams then. We had 5 mentorship managers, so each mentorship manager mentored 2 teams. Now in the finalist phase, we have 4 teams and 4 mentorship managers. Teams also have access to a panel of subject matter experts who cover expertise across all aspects of simulation training, assessment, project development, and more. Since the start of the discovery phase, we had 111 meetings. 85 meetings were with mentorship managers and 26 with subject matter experts. We have 32 subject matter experts, both from RCSI and from other institutions. There are 8 institutions from 8 countries represented. And it is important to note that we did not have the full panel of 32 people at the beginning of Discovery Award phase. But the whole principle of working in the mentorship program is that we react to the needs that are identified by the teams and to the support that they identify that they need. So we adjusted the panel, introduced new areas and introduced new people as we went forward. Sometimes a need identified would be something that was common for most teams or all teams. So in that case, we would organize a workshop and invite a few subject matter experts to talk about the topic and work with teams on it. So at the beginning of the challenge, that was team and project management, later on self-assessment, and the latest workshop we had was in September, and as the end of the challenge is very close, it was on the topic of scaling up beyond the challenge. And here you can see a wide variety of areas that our subject matter experts cover. So from management and leadership to education and assessment, where a particular emphasis was and the highest need was on self-assessment, on e-learning methodologies, simulation in low resource contexts and in specific specialties. Then in simulation technology, AR and VR, AI, data science, etc., images, videos, and sound. And the area that was added the last, basically the reaction to what teams were asking, and based on the phase they were in with their project, it was engineering and design for manufacturing. A survey was conducted with teams, mentorship managers, and subject matter experts at the end of the Discovery Award phase. Some strengths of the program identified by mentorship managers were that they felt that this collaboration empowered many individuals and helped create a network of educators across countries. They also felt that mentorship manager program is leveling the playing field. Some teams were engaging more than others, and the very strongest teams may in fact not benefit hugely, but the program likely most benefits the teams that are most low and middle income country based. And on the other hand, some of the most commonly mentioned weaknesses was challenging communication at times across all aspects of the program, and difficulty for mentorship managers to really grasp everything the teams were trying to do. And this also speaks a lot about the complexity of the projects that the teams are developing, and also the challenge of this size has a lot of moving parts. So sometimes the communication between different aspects can be challenging, as mentorship managers mentioned. When it comes to teams, the most beneficial aspects of the mentorship program, in their opinion, was mentorship managers' experience and guidance through structured, goal-oriented framework of the program, connecting teams with subject matter experts, and assistance in accessing literature needed for the project. And this is connected to the comment by mentorship managers that maybe the teams based in low and middle income countries are those who benefit the most, and especially with the difficulties they would normally have with accessing literature. Some unexpected consequences of participating in the mentoring program is that regular meetings help teams gain renewed energy and enthusiasm, connections with experts from all over the world, and feedback from mentorship managers helped identify weaknesses and direct towards more realistic and doable goals. When asked about subject matter experts, team emphasized that many development decisions were improved because of the discussions they had during meetings with subject matter experts. And some of the comments from the teams, for example, that they had a tough time getting on with their original idea of tissue modeling, but once their mentor connected them to a subject matter expert, they got the help they needed to decide on the path that they should take for the project. Another team said that they needed expertise in a variety of areas, such as impact of problem, AR object tracking, self-assessment, clinical validation, and they got perfect experts for all of those. And another comment said that they were able to meet many subject experts and they hope to leverage these connections in the future. And to conclude, the program has shown that RCSI, with its network of experts in relevant subject matter areas, is well placed to support teams in the challenge. Teams are provided with access to conversations tailored to their current progress, which address issues they're encountering. And it is important to emphasize here that all the conversations are guided by the teams. They are the ones who identify their needs. We just react and support those. The programme is a successful model for leveraging the resources of institutions in high-income countries to support innovators in low and middle-income countries. Thank you for your attention.